Equity is a very huge term. It's not easy to define equity. Frequently there is a mistake between equality and equity. And if we think in terms of healthcare system, as a medical doctor, I try always to bring equity, taking into account the specific needs of the patient, but also her or his social determinants of health. That's the idea. If I bring an equal treatment, probably I will be not right in many situations. Equity means more concern about the specific needs of each one. There are many objectives in this summer school. First of all, the idea is to take into account that we have to define the concept. So first, the concepts and the foundations. After that, we are going to, in much depth, try to understand some topics like COVID-19 and health equity, climate change and health equity, forced migration and health equity, gender topics and health equity. So what we are going to bring is different topics of importance related with health equity and through the point of view of different specialists. We host more than 20 speakers from 6 different countries. The idea is to bring from their land, from their perspective, a piece of knowledge concerning those huge puzzles of health equity. That's the idea. They come from different backgrounds. We have social epidemiologists, we have social science actors, public health actors, physicians, clinicians, researchers, policy actors. So different words, and the idea is to have a sharing ideas continuously during all the week. Well, the target audience is most of them doctors, PhD doctors, postdocs. That's the first audience that we expect. But we would like also to have actors from the WHO, actors from the public health offices at the national but also at the international level. Basically to have the opportunity to have a network of people who could in the next future influence the topic of equity at the society level but also inside the healthcare system. We have 1 week teaching courses. We try to have interaction all the time, and something that is interesting is that we have 4 dimensions each day. One who will be more oriented to the academics, the second one more to the healthcare actor, the third one more to the policymakers, and the last one to the society in general. And we will bring also the possibility to go inside the community. We are going to visit different structures who take care of population in situations of vulnerability and potentially at risk of inequities. The organization with the University of Lausanne brings us the possibility to be here in this beautiful campus. Now, the University of Lausanne, the Faculty of Biology and Medicine, and UNIL, the University Center of Ambulatory Care and Public Health, they have all a strong link with health equity because the university and the faculty have created an academic chair of medicine for vulnerable populations, for people in situations of vulnerability. And UNIL brings the possibility to every people to go inside the healthcare system. Whenever you are poor, or your ethnicity, or your religion, your gender. We have different actors, different what we call sponsor. We have the Swiss Agency for Development and Cooperation at the national level, the WHO, as I mentioned. We have the Centre Universitaire de Médecine Générale et Santé Publique, UNIL, CHUV, le Centre Hospitalier Universitaire Vaudois, and the University of Lausanne.